So we'll quickly try to look at another concept here in childbirth and delivery, and this is what is known as the artificial rupture of membranes. Artificial rupture of membranes. So for artificial rupture of membranes, it's more of like, okay, a woman wants to deliver, the cervix and everything is dilated, but the amniotic sac, that's like the balloon that the baby usually is in, happens to still be intact. It has not ruptured yet. Okay, so you can just artificially rupture it for the woman. Like you are using, okay, some one or two, methods to rupture it, of course. So you are using some instrument that have some pointed mouths to just rupture it. Okay, so they can call them amnihook, they can call them amniocut, they have different names. So artificial rupture of membranes is also known as amniotomy. It's a medical procedure. It's used during labor to intentionally break the amniotic sac. So that's the the bag surrounding the fetus. So it's typically done by a healthcare provider to help stimulate or accelerate this labor that has already started. So what happens during this artificial rupture of membranes? A sterile instrument, it could be amnihook or amniotic, amniocut. Okay, some people can use forceps too. Okay, so the provider punctures the amniotic sac. This will now allow the amniotic fluid to now drain out. This will now increase the pressure on the cervix, so more hormones will be released, and this will now cause the woman to contract more so that the baby can be put on the outside. So it may be performed for several reasons: to induce or speed up labor, also to monitor the baby more closely, to access the amniotic fluid, to check if the baby has passed out the first stool in the amniotic sac, to also relieve pressure in cases of the amniotic fluid is too much, that's a polyhydramnios. So risks and consideration is if you burst out the membranes and the delivery doesn't come out ASAP, okay, it can lead to infection, and sometimes the amniotic fluid is what is suspending the umbilical cord. So if you burst it, the umbilical cord can now collapse, block the birth canal. That's umbilical cord prolapse. There's also increased pain because contractions are much more stronger now. Okay, so how is it done safely? First of all, you have to perform it under sterile conditions. You can't be taking infections from outside to put it into the mother. All right, so cervix should be partially dilated, so the baby's head should be engaged into the pelvis. Now fetal heart should be monitored all along to ensure that the baby is doing fine.